This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neuro Health broadcast. I'm your host, Dr. Carafa, and today I'm very excited to be live and in person with Delta Neuro Health's newest member, Dr. Carafa.
Hello, thank you for having me here.
So Dr. Carafa, I'll just talk to you guys for a little bit, and then we're gonna, have a chat ourselves, and you can listen in a bit. But Dr. Carafa has been a great new addition, recent grad. She's really knowledgeable about functional neurology and a whole host of other things that I think is going to be very beneficial for the patients here at Delta Neuro Health. So welcome aboard, Dr. Carafa.
Thank you so much. I'm very glad to be here and be part of the team. It is a wonderful community already. I just completed my first month here, and I have loved every minute of it, working with you and the amazing patients here in the Westerville community.
Yeah. Well, I know they've been grateful to have you already. You've jumped right in. You've handled the pressure very well, and we're very grateful to have you.
Thank you.
So I'm always curious with my guests, why they got into the space they're in. So in our case, functional neurology. So tell me a little bit about your story.
Yeah, so I would say my journey started really when I was in chiropractic school. I didn't know too much about functional neurology and the world of it. I just knew I wanted to help people from a very young age. So when I went to Life University, they have a clinic there called NeuroLife, kind of where it all sort of started, and I immediately grew interested in it. I spent some hours there and got involved with the Functional Neurology Club, where I really learned sort of the basics of functional neurology, how it can help people. There are many doctors that I was able to shadow and work with that really, to me, opened up the world of functional neurology and the toolbox of support and different, therapies that we can use to help people. And it also I feel like I'm starting to begin with the journey of it, even though I've been in it for, I guess, a few years now. But to say, finding the intricate relationship between the brain and the body, and from there, how can I find targeted, specific techniques for each and every one of our patient. And I love how objective it is. We have clear pre and post measurements for our patients. I absolutely love that. I love how it is so dynamic for every patient, so it feels like it's very individualized care for every one of our patients. And I also like how I get to know our patients personally. We typically do an hour-long appointment here. When I shadowed and was an intern, they were about half an hour appointments, but even then, that's longer, I feel like, than a typical chiropractic appointment. So getting to know patients, growing my observational skills as well, realizing we as humans have our own, little attributes about us, I guess, that we can view clinically and just grow our skills better every day.
Yeah, no, well said. Yeah, I think what you said there, that's something I definitely appreciate about being able to do what we do. Just spending that time with patients, really getting to know them, not just on a what's their condition, but them personally. How
Right.
can we connect with them personally, and make their care even more specific to them.
Yeah.
Because at the end of the day, that's what it's all about. So
Yeah.
But that's great. So what are some of so functional neurology, can we just define that really quick? I'm sure if people have been listening to this podcast, they probably have a pretty good idea of what functional neurology is, but can you just define that for us, maybe in your words?
Yeah, I mean, where to even begin with it? I'm probably not doing it the justice that it deserves, but I would say that functional neurology is the relationship between the brain and the body. and the intricate connections between it, understanding the motor pathways, the sensory pathways, the cranial pathways, everything that makes us human, understanding those pathways, so then we can apply targeted, individualized care for each and every person, because, every single person is different. So therefore our treatment should be different for every single patient. So I guess that would be my best but very vague definition, I would say, of functional neurology.
Yeah, and I think piggybacking off of that, no two brains are ever the same.
Right.
So no two brain rehabs are really ever the same. So
yeah, absolutely.
Makes it challenging but rewarding.
Yeah, sometimes I feel like I have to be almost a detective of figuring out what works best for my patient. So a lot of times we are taught, you see this lesion here, do this therapy, but that doesn't always mean that that's going to be the best for the patient. It could be something completely different, where we target one side of the brain versus the other, where it may not be textbook. A lot of the times it's not textbook. We were like, right. As we start to, work together, and as I'm starting to develop too as a new doctor, but it's something that I am so eager to learn and grow from, to just be the best doctor I can be for my patients. Because already seeing the impact that you have with your patients, seeing them, I had a great weekend, I had a great time with my family, I was able to walk again, I was able to get out of my wheelchair, or I went to the concert this weekend that I didn't think I would make it to, where I can work. It's life-changing things that we see every day for our patients. So it is such a rewarding, career that I chose. Yeah. And I think I just happened to be there at the perfect time, perfect place to be there.
Yeah. Well, you've got all the right experience to step right in and start changing people's lives, so it's really exciting.
Thank you.
And I do want to ask also, functional neurology is so vast. We can address a number of different things for a number of different, conditions, right? What are some patient populations that you're really drawn to help?
Yeah, that's a great question. I am open to as many different conditions as I want to be. However, during the time, especially during my internship, I grew a love towards movement disorders, so tremors, tics. I would say post-stroke patients. So during my time at Georgia Chiropractic Neurology Center, we were helping a lot of patients rehab, learning to walk again, learning to use their arm again, pick up a spoon, and I loved that kind of work. I love POTS and dysautonomia patients. We have a lot of those cases here in the office, which I have also loved to enjoy. I like vestibular, like BPPV, post-concussion even, I guess, can fall under that. Really, I'm open to any sort of challenge that lands on my plate, but I would say I have a couple specific ones that I really enjoy.
Yeah. And like you said, it's a challenge. Every patient's a challenge to some degree, and while they may be given a certain diagnosis or may seem like they fit in a certain category or box, at the end of the day, a lot of people will throw you curveballs, so just figuring out how to field those curveballs is going to be important. But
absolutely.
So you come to the clinic with some really interesting skills, in that you're really, really skilled with fascia. Now, patients or people listening to this may not inherently know why that's important neurologically.
Sure.
But can you just touch on why and how that can be so beneficial to a patient's overall neurological recovery?
Yeah, absolutely. So to kind of where I learned that from was from Dr. Mark Ellis. He was my mentor. He was a massage therapist before he was a functional neurologist. And so he really helped introduce the world of fascia and a technique called myosynaptics. So it's something I'll be writing on very soon. But myosynaptics in the fascia world, how at least I have learned it, is so we can view fascia functionally as a type of web, I would describe it, that wraps around everything in our body, from muscles to muscles, blood vessels, lymph nodes, bones. It wraps around everything. And so when we view it that way, you can start to see how it can interconnect, because not only is fascia helps us move, but it also is it's a sensory component as well. So it's constantly talking to each other, therefore talking to the brain to give the correct or possibly incorrect information as well. So a lot of us know scar tissue, for an example. So post-surgery, or you were injured in some way, scar tissue can form, which can then give inappropriate feedback or different abnormal sensation to the brain, saying to stop movement or restrict movement when it comes to like moving our bicep, for an example. So let's say there's scar tissue in the bicep and it's hard for us to move, therefore it's harder for us maybe to do a daily thing like the way that we work, for an example. So my job when it comes to myosynaptics would to be through very gentle but targeted therapy, like very light. A lot of patients I've already started to kind of work with say it's very light, but it's targeted work to slide or break up the fascial adhesions. It may not be necessarily scar tissue. It might be the web is a little bit tighter in some areas, so it's more interlocked. And that could be from a variety of different reasons as to why it is that way. But it's my job through light tissue pulls to break up that fascial adhesion so that we could increase range of motion, possibly decrease pain if there is pain in that area. And the huge connection that it has to the brain is that is also brain rehabilitation as well. Just like functional neurology, they work hand in hand together, because as we break up the fascial adhesion, it's giving better proprioception, or knowing where our body is in space, proprioceptive feedback to the brain, so that our brain gives us a better idea of how to move our body. So it works very hand in hand. Mm-hmm. And so doing brain rehabilitation along with soft tissue work is just the perfect combination, I think, when it comes to helping patients. And it could be any sort of condition too, not just I just got out of a surgery and I feel restriction. It could be anyone that has, scar tissue or fascial adhesions.
Yeah, love that. You had mentioned earlier that you had fallen in love with working with movement disorders. Mm-hmm. And it's interesting, you've also fallen in love with fascial work. So I'm curious, do you have any examples or stories on how fascial work has been impactful for movement disorders?
Yeah, it's a really good question. I remember seeing a couple of different hyperkinetic, so meaning that patients are they're moving too much, meaning that they have a tremor or a tic. So I can remember specifically a patient who had a head tremor, meaning that their head wouldn't stop moving when they didn't want it to. So we do similar rehab where we do the exact same practice or therapy that we do here at Delta Neuro Health. The same one I did at Georgia Chiropractic Neurology Center is a way that we can help with neck proprioception is putting a laser on a patient's forehead basically and have them trace around almost like a butterfly sort of pattern. So patients with tremors, especially a head tremor, it's going to be really difficult for them, of course, because we want them to stay within the line so that we can really be specific about our therapy basically. So when they can't stay within the line, you could do a tissue pull, basically a nice light tissue pull on the neck, and that will give better feedback. Once again, proprioception, it's resetting these muscle spindles basically. That's basically these tiny little, I don't even know how to describe like muscle spindles.
Tendrils or like hooks,
yeah,
and like a zipper?
Yeah, almost. So these tiny little fibers in the body basically that help us initiate movement. So when you reset that through a tissue pull, for an example, through in a correct vector and velocity, so it might be able to, like, it might be a nice soft just pull or a push or rotating or like torsioning the skin, even depending on, you know, what we feel as far as the fascial adhesion, that then helped regulate and calm down almost the tremor, because it was giving better feedback to the brain essentially. So I saw a couple of different, and it was not just head tremors. I saw hand tremors, leg tremor, like the leg wouldn't stop moving. I saw, yeah, all sorts of different. That's kind of the first one I would say that comes to my brain, would be like a hyperkinetic disorder.
Yeah.
So moving too much, basically.
Yeah.
Getting that to just kind of inhibit properly to make a smoother movement.
Right. So it's possible that, you know, essentially fascial adhesions can lead to miscommunication between the brain and the body.
Yeah.
Essentially, so you could have that hyperkinetic disorder because of those fascial adhesions. So or maybe facilitated by those fascial adhesions. So, you know, just by tweaking things, little things here and there, dialing it in just the right way, with some skilled hands and knowledge, you can essentially calm that down, and you know, your therapies then, your functional neurology therapies, your brain-based therapies can then be even more effective.
Yeah, absolutely. 100%. That's a great way to summarize it.
Okay. Well, that's great. I love that. Well, again, I'm very excited to have you on the team. I know we're going to have Dr. Carafa on here in the future. Maybe we're going to go over maybe some specific topics together, different cases potentially, and different conditions that we work with, and approaches we take. So I think you'll be seeing a lot more of Dr. Carafa here in the future. But for now, we'll say take care, and we'll see you in the next one.
Thank you so much for having me. I appreciate being here and being part of the family.